Good evening. I am Dr. Ren Lester, the Chief Experience Officer at the University Hospital of Brooklyn. Thank you all for joining us this evening for our second session on COVID-19, Community Conversations on the COVID-19 Vaccine. It has been almost a year since we saw our first case of a patient with COVID-19 in New York State. And here we are a year later, and we have an effective set of vaccines. This session is to provide you with information so you can make the best decision for you and your family. Today, we are joined by the Honorable Councilman, Dr. Matthew Eugene of New York City Council District 40, who requested this event and will give welcoming remarks. Good evening, Councilman Eugene. Please take us away.
Good evening. I'm New York City Council Member Matthew Eugene, and I represent Brooklyn 48th District, which is home to the wonderful medical institution, SUNY Downstate Medical Center, under the leadership of Dr. Wayne Riley. I want to thank the doctors, nurses, and medical professionals who have made tonight's event possible, and our distinguished panelists from the medical field. I also want to welcome all our community members who have joined us online this evening. This information session is especially important and one that is, I believe, will have an immediate impact in the community. As we discuss the COVID-19 vaccine, its safety, and questions on how it treats the virus, especially in communities heavily impacted, such as Flatbush. COVID-19 is a serious disease. That is why our schools, businesses, offices, and places of worship were shut down to protect the community and allow our medical professionals to work to treat the illness. I want to take a moment to thank the medical professionals, both here in Brooklyn and across the global community, who have been doing their very best to save life. The speed at which a vaccine was created is truly remarkable, and it is a testament to the dedication and commitment that our scientists and researchers have to save life. Our first responders have been risking their lives every single day. It is emotionally and physically traumatizing, and yet they continue to serve us as best they can. I want to emphasize that the novel coronavirus remains a serious threat to the public health, even with a proven vaccine. It is deadly and can cause long-term damage to our health. And that is why there is an urgency to discuss vaccine and explain how important it is for the people to take it. As a medical doctor myself, I have seen up close the damage that similar types of illness have caused. But we know that COVID-19 has created an historic loss of life, jobs, housing, and resources to our society. People cannot congregate and do not activities without taking extra precaution. It has fundamentally changed our way of life, and it has shaped outlook of the future, and why I understand that it is important, but I understand that there is an hesitancy about the vaccine. But I want to say that it is very important for people to take it. And it is necessarily important for us to reopen our city and resuming our life. If we do not have the full vaccinations, it will only prolong the effect to rebuild the economy, get people back to work, back in school, and help people get their life in order. I want to thank everyone who have taken the initiative to wear masks, wash their hands frequently, and stay home when it's necessary. It is also important to remember that viruses are part of our life, with some are more harmful than others. We have seen the impact of viruses many years ago, the Spanish flu, for example, and then more recently, SARS, MERS, swine flu, H1N1, and Ebola. We have known the viruses, we know that viruses mutate and have variants, which we are seeing right now in areas around the world. This is normal behavior for virus, but it means that we must remain vigilant against it. Viruses will always be with us as human beings. And more importantly, there will be another virus similar to COVID-19 that emerge at some point. This is something that we must be aware of and we must be prepared for it. It is the reason why I introduced legislation in 2018 that was adopted in the City Council by the City Council calling for the creation of standalone medical facilities and also the creation of a special permanent commission to study the spread of infectious disease, epidemic, and pandemic like COVID-19. These measures are necessary to protect the health of the community from future public health crises. So the next time we are faced with the outbreak of infectious disease, we do not have to face similar circumstances that disrupt our way of life. As a community, I believe that we will continue to be resilient and we will recover from this horrible virus because we are a strong city and we have been through difficult time before. But it will take the continued cooperation of all of us. And it will be important to wear masks and practice social distancing even after receiving the vaccine. I want to thank everyone who have put this forum together. And I want to thank our healthcare for their expertise and for putting for the very best effort for the past year to help protect New Yorkers from COVID-19. And on behalf of the community, and also on my own behalf, I want to thank all of you from the wonderful institution, Downstate Medical Center. And I want to again to commend you and congratulate you for what you have been doing for many years, protecting the life of people, doing God's works. And I know that you have been in the forefront of the crisis. For that, on behalf of the great city of New York, on my behalf, on behalf of all my constituents, thank you so very much. And I want to thank especially from the bottom of my heart, Dr. Salifu, who came with the idea, and also his wonderful staff. Thank you very much, and God bless you all. And let's stay safe. Thank you.
Thank you, Councilman Eugene, for those wonderful remarks. So let's get started with our program. We have invited the following expert panelists: Dr. Moro Salifu, Chair of the Department of Medicine, Brooklyn Health Disparities Center; Ms. Patricia Winston, the Senior Vice President of Hospital Operations; Dr. Rami Nakashbandi, Interim Chief Medical Officer, Chief Quality Officer; Ms. Cheryl Ralston, Interim Chief Nursing Officer; Dr. Michael Augenbrand, Director, Division of Infectious Disease; Dr. Camille Clare, Chair of the Department of Obstetrics and Gynecology; Dr. Marilyn Fraser, Chief Executive Officer of the Arthur Ashe Institute of Urban Health, Brooklyn Health Disparities Center. This evening's session will be moderated by Dr. Carla Boutin Foster, Associate Dean, Office of Diversity Education Research at Downstate, and Dr. Pamela Straker, Director of Operations for Brooklyn Health Disparities Center. Now, Dr. Straker.
Good evening, everyone, and thank you so much for attending. Just to clarify, I'd like to now introduce Dr. Mauro Salafu, who is the chair of medicine at SUNY Downstate Medical Center or Health Sciences Center. He is also the director or one of the directors at Brooklyn Health Disparities Center. He will present for you now some statistical information, and he'll be followed by Dr. Marilyn Frazier, who is also a director at Brooklyn Health Disparities Center.
Good evening to everyone, and thank you for coming to this very important event. I would first of all like to thank the councilman, Dr. Matthew Eugene, for all the things that he does for our community and always standing by SUNY Downstate Medical Center. This event is so important because it tells you that we can have a community and a hospital partnership that would allow free flow of information between the experts and those who are seeking to know more about diseases. And I hope that this is the first of many to come, such that the community and the hospital can sit together, discuss things, and ask questions and be able to work together to solve common problems. So the objective here today is to get all our experts in the field, those who are very familiar with the COVID-19 pandemic and the vaccination protocols, to be able to give you pointed information and also to be able to take questions from you. A lot of the answers they'll be given to you are evidence-based, things that we know now. Obviously, there are more things to come, and as the evidence begins to unfold, we will bring more to you as we have these events. But having listened to what the councilman said, I don't know whether we can follow his steps. He said some very, very good things. Please stay safe. Keep yourselves, your families, and everybody follow the protocols with the masks, and try to consider the fact that this COVID-19 pandemic is not over, and we have to fight. So the goal is to fight the pandemic and give all the information that is needed for people to be comfortable making the decision on the vaccination. So here is our councilman, always engaged with his community. We love him so much. So thank you for all you do. This is SUNY Downstate Medical Center. SUNY Downstate, the name is a big name because it has so many things happening. And I don't know whether the community knows that these are all happening at Downstate. We have a very large medical school, which is the largest in New York State. We have one of the biggest hospitals in New York, providing all the education to everybody else, and also supporting the community in terms of all these emergencies. We are your hospital. We are here for you. We want to take care of you. We also have a school of public health that trains the public health officials and the executives. We also have a school of health-related professions that trains the advanced practice providers, a school of nursing. So if you want to train in nursing, in any degree in nursing, SUNY Downstate would be by your side. We also have the school to train the future scientists. So it's a very, very important institution in Brooklyn, and we are happy that our councilman is Dr. Matthew Eugene. This is the Brooklyn Health Disparities Center. This is a very unique partnership that is between the university and the Arthur Ashe Institute for Urban Health and the Office of the Brooklyn Borough President. The reason it's the partnership is because you need all these elements to be able to address health disparities. In other words, when government and community and hospitals come together, we can listen to each other and solve problems. When one person is doing it, it's very hard to get the results. So that is the partnership. And the mission of the partnership is to eliminate health disparities in Brooklyn. So this is the statistics as of today. This is hot from the press. Okay, this is New York Times today. Look at what happened in December. We went through the holidays, and then we came out of the holidays with a lot of COVID-19 infections. We peaked around the middle of January. It started to improve a little bit, but you see that even now, as of yesterday, the number of infections have not gone down below what it was before the holidays. So we are still not out of the woods yet. Look at the number of hospitalizations, right? This is before the holidays, around December. It went up and up and up. It sort of plateaued and never went down, to levels, before the holidays. Look at the number of deaths, same thing. The number of people being tested positive is the same thing. It hasn't gone down below the baseline before we enter the holidays. So the infection is really here, and we have to fight. So the vaccine, the vaccine story is evolving. As more and more vaccine is available, more people will get it. But for now, it is people over 65 and older, healthcare workers, first responders, and support staff. So basically, if you think that you are a first responder in anything, that is, you are interacting with the public, at this point, you might qualify for the vaccine. And the list grows with time as we get more and more vaccine availability. This is also hot from the press today. This is a graph talking about where we are in terms of vaccinations in the country. Right now, we are 16% for the first dose. So we are nowhere close to where we want to be. We want to be around 70 to 90% in order to do the things that the councilman talked about. Be able to get back to normal life, be able to get back our schools, be able to go into the restaurants, be able to ride the buses safely, be able to go into the trains, all the stuff and go shopping. All the stuff that we would normally do would happen when we get to around 70 to 90% of the population immunized. But look at where we are today. We are only 16%, right? And now if you look at the projections, it looks like maybe around August, September is where we are probably going to be hitting the 70%. But depends on how production of the vaccine goes. If the production goes faster than projected, we might get a little bit sooner. But this is the projection that we have right now. And this 16% nationally is exactly the same as what we have in Brooklyn. It's about 15, 16% of the first vaccinations. And the people who have had 2 vaccines is only 8%. So we are a long way to fighting this disease in terms of vaccinations. So I wanted to give you this background information before we get into the questions. So thank you.
Good afternoon, everyone. I thank you for joining us this afternoon. As Dr. Salafu just mentioned, we are a long way away from where we need to be. And we know that within our communities that there are a lot of hesitancy. We know that people have so many questions. We realize and we recognize that there are historical things that might have caused you to be hesitant, that might cause you to not want to take a vaccine or trust that. But we wanted to make sure that today we were providing you with all the information necessary, that your questions could be answered so that you can make those informed decisions, that you can get back to regular life as you know it. And we wanted to do that because we know as SUNY Downstate Health Sciences University, we are in a community that was really hit hard with COVID-19, hit hard by COVID-19. And in recognizing that, we wanted to make sure that we had the opportunity to reach out to you and have this conversation. And so this afternoon, as Dr. Salafu mentioned, as Dr. Matthew Eugene mentioned, we want to make sure that the conversation happens so that you have the information that you need and your questions are being answered. And we encourage you to ask those questions because we have the experts here. And without further ado, I would like to just turn it over to Dr. Carla Boutin Foster, who will take it away and get to the meat of what you're here for, to hear more about the vaccine. Thank you, Dr. Foster.
Thank you so much, Dr. Frazier, Dr. Salafu, and Councilman Eugene for really creating this space where we can share information. As you've been hearing, we have a long way to go, but we've also come very far. And this evening we've gathered experts here to provide you with the information, as Dr. Salafu said, that can help you make the best decision for you and your family members about the vaccine. So I'd like to get us started. We have a series of questions that members of the community have posed, as well as members of the healthcare team would like to ask. So the first question is to Dr. Ogden-Brown. So we've been hearing about COVID vaccine. We've been waiting, this is almost a year to date since we started talking about COVID. And now we have these vaccines. Can you tell us about the vaccines? In particular, we've been hearing about mRNA. So what is the mRNA vaccine? How does it work? Can you share some of that with us, please?
Sure. It's been my privilege to serve this community now for over 35 years. I'm happy to say that and happy to continue in that role. First, let me say that pound for pound, vaccines have been probably one of the most important medical interventions we have ever developed in medical sciences. Their contribution is outstanding and their safety record is also outstanding. I think in some ways the problem with vaccines is that when they work, nothing happens. You take a medicine for a condition, you get better. You go for surgery for a condition, you get better. It's dramatic. when we apply the use of vaccines in the community, diseases disappear and we forget about them. Diphtheria, polio, tetanus, and that's part of the problem, I think, of marketing vaccines. But getting specifically to your question about mRNA vaccines, it's a relatively new concept, but it's the fruit of a lot of biomedical research that's been going on for decades now. And what they do is they use the body's own mechanism for producing proteins in order to produce these proteins so that it induces an immune reaction. It's nothing more complicated than that. And it's not really been around just in the last 6 to 9 months. It's something that's been worked on for over a decade, but it's taken scientists some time to sort of tweak the process so that it can be used effectively. And now we have it. It is effective.
So you said, you talked about our bodies. So will this mRNA vaccine change my body, change my DNA? How long will this be in my body?
Yeah, that's the concern of a lot of people, I think, when they first hear about this. But it's far from the case that this will have any lasting effect on the body, on its DNA. It doesn't enter the nucleus of a cell. People remember their biology lessons from high school or grade school. In order to affect DNA, the material has to go into the nucleus of the cell. The mRNA viruses stay in another compartment of the cell and just take over small bits for the manufacturer of proteins, the proteins that represent the coronavirus, so that, again, the body's immune system can then recognize those proteins.
That's helpful. So now we've been talking about 2 vaccines, Pfizer and Moderna. And now there's another vaccine that we're hearing about, Johnson & Johnson. I know it's early, I know it's new. I believe it was just approved this weekend.
Monday.
Yeah, so it's hot off the press. Can you share any information about the Johnson & Johnson vaccine with us?
The Johnson & Johnson vaccine works well. I mean, all of these vaccines work well. They have upwards of, in the case of the Pfizer and the Moderna vaccine, the efficacy of these vaccines for preventing actual coronavirus infection is in excess of 90%, which is remarkable, a remarkable thing. The Johnson & Johnson vaccine seems to be a little bit less effective in sheer numbers. It's probably more on the order of 70-75%, but you have to understand that the Johnson & Johnson vaccine was studied later than the Pfizer and Moderna vaccines. And so the efficacy against some of the strains of the virus may have caused it to work a little less well. But all of these vaccines seem to do one thing, and that is prevent the most serious consequence of this disease, which is death. I mean, in all of the instances where the studies were conducted, these vaccines seem to prevent, if they didn't prevent disease itself, they prevented severity of disease. And that's really what we're interested in. If coronavirus was a common cold, none of us would complain about it, or somebody would complain about it, I'm sure. But, if it was a common cold, it wouldn't be a big deal. It's in its capacity to cause severe disease and death. That's where we need to stop it. And all these vaccines seem to work in that way.
So that is really reassuring. So our end goal is to minimize severe disease, hospitalizations, and death. Yeah. And I think that's something that we can all, agree on, that we want to prevent serious illness and death. So thank you, Dr. Brown. So Dr. Nakashbandi, I'd like to turn the next question to you, and that is, can you tell us a little bit about how we were able to develop 3 vaccines in a short time period? While it sounds like what Dr. Brown was saying, that this isn't new. We've been, our scientists have been working on this. Can you tell us a little bit about the trials, and also how representative were the participants of our community?
Thank you, Dr. Booten. And first, I would like to thank everyone for organizing this really great event. I'm honored also to serve this community. I did my fellowship in Downstate, and I was privileged to come back and work with an outstanding team in Downstate to serve this great community. And this is really a great question, actually. So there are multiple factors contributed to the quick development of the COVID vaccine. First, scientists have not started from scratch when they developed the vaccine. They knew the mRNA vaccine technology Dr. Ogebran was talking about. It's not new. It's been under development in the last couple of decades. Also, SARS coronavirus 2, even though it's the novel virus responsible for COVID-19 disease, but it's a member of the coronavirus family, including those caused common cold or caused SARS in 2002 or MERS in 2012. So scientists have been studying coronaviruses for many, many years, and they had already existing data on the structure and the genome and the life cycle of this type of virus, which facilitate the process of developing the vaccine. Second, since this is a global pandemic and had a very high mortality rate, there was a worldwide collaboration to develop the vaccine. And there were a high number of governmental and private companies all over the world interested in funding the research supporting the development of the vaccine. We know the financial aspect of developing the vaccine is one of the most obstacles. Also, as there was a lot of public interest to help in developing the vaccine, and that was supported by advanced technology and social media. So that helped significantly in recruiting a lot of volunteers to be part of the studies for the vaccine development in a very short period of time. And without those volunteers, we could have not run the trials. And finally, since COVID-19 pandemic, as I mentioned, had a lot of impact on the mortality worldwide, pharmaceutical companies were willing to start manufacturing the vaccine even before it was emergency approved. So they will be ready to distribute the vaccine as soon as the studies are done and the vaccine gets emergency approval. So all these factors helped in developing the vaccine in a record time, actually. But I want to emphasize that all the vaccines that have received emergency authorizations, as you mentioned, Dr. Boutin, have undergone vigorous testing to ensure that they are safe and effective.
So safe and effective. But I'm going to go back to the safe. Side effects. I know we've been administering vaccines for a couple of months now. I know I got my vaccine New Year's Eve. I entered 2021 having received the vaccine. So can you just share experiences in terms of side effects that have been reported? What have we learned thus far about side effects, what we should look out for from our experiences?
So there are no major or specific safety concerns related to any of the vaccines reported in all the trials. As an example, here at Downstate, we vaccinated around 4,200 or even more, 4,250 people with either Pfizer or Moderna vaccine. And there were no major side effects and no cases with anaphylactic reaction, as we heard about the allergic reaction to the vaccine. There were some mild side effects, which is all reported, the same reported in the trials, like flu-like symptoms, which is mild fever, headache, fatigue, some inflammation at the site of injection, like any other injectable medication. And also there are some people who are allergic to the vaccine, they got allergic reaction, like any other medication which could have allergic reaction. But there was no major side effect, or there is no that significant side effects were reported in Downstate or global-wise.
Well, thank you very much. So now I'm going to turn over the mic, so to speak, to Dr. Pamela Straker, who will continue with some more questions. Thank you, Dr. Straker.
I have a question for Ms. Cheryl Ralston. So when a person has had their full doses of the vaccine, when can they stop wearing a mask?
So there is really no stop date for when you can stop wearing the mask. It takes a couple of weeks before even after you've received the vaccination, for you to start developing the immunity to the virus. In addition, you could have had exposure to the virus and you can still be carrying the virus. So if you sneeze or you cough, you can spread the virus. So it's important for us to still wear the mask and for us to still do social distancing.
Okay. All right. And Dr. Camille A. Claire, if a person is pregnant or planning to become pregnant in the near future, should that person get the vaccine?
Thank you for this important question. And again, thanks to Councilman Eugene for facilitating this conversation. I really appreciate the opportunity as an obstetrician gynecologist to impart what we do know for pregnant persons and those who are planning to become pregnant. as well as those who are breastfeeding. So we know for pregnant persons in particular, the impact of COVID vaccine disease is much worse than other people. So those are the people that are more likely to have mechanical ventilations. Those are the people that we saw in the last year who are more likely to die from this infection. So the impact of getting the COVID vaccine, or getting COVID-19 rather, is really, really high in pregnant persons. So the original studies were not conducted, the preclinical studies were not conducted on pregnant persons. So we don't really exactly know the effects of vaccination on pregnant people. However, as an organization, I'm a member of the American College of Obstetricians and Gynecologists. Those are the bodies, as well as the Society of Maternal Fetal Medicine. Those are the obstetricians that work with pregnant people who have high-risk conditions. Both of us as a group, as two organizations, have recommended for pregnant persons to become vaccinated. We also know that to date, about between 100,000 to about 330,000 healthcare workers have received the vaccination to date. So that is important information. So it's important to make that decision if you have conditions that put you at risk. So for example, you're pregnant and you have several medical conditions that can put you at an additional risk, to speak to your obstetrician to make that decision. We also know that Pfizer has started trials and started trials for pregnant persons to date. So we should have that information in the next few months about the impact of pregnant people. So I can't tell you exactly, but we do highly suggest that you make that informed decision with your obstetrician or your obstetrical provider. So that's extremely important. And again, just as everyone has said, for pregnant persons in particular, social distancing, again, avoiding large crowds, again, wearing your masks, again, is really important. That's an individual decision to be vaccinated. It's not my place to tell you to do so or not, but I'm really here to encourage vaccine confidence. I'm calling it vaccine confidence, not hesitancy, to answer your questions, to be able to make that informed decision.
Thank you so much, Dr. Claire. There is a second question for you, and that involves children. If I have young children, can they receive the vaccine?
Well, you know, according to my pediatric colleagues, again, the pediatric colleagues, which I am not, they have not, there's no data regarding children and receiving the vaccination to my knowledge. My colleagues can surely jump in if they have any additional comments to that. And so I can't say whether or not that particular group, we can encourage them to be vaccinated. But I also know from what I've read that children are starting to be included in trials as well. And so that information will be forthcoming very, very soon. But as an obstetrician, on the other side of the table, I like to say, again, making that decision with your provider is really, really key.
Thank you so much. And that will be helpful for people as they begin to think about sending their children back to school. Um, Ms. Winston, I'd like to know, when will the vaccine be available to others in the community? There are people who have been vaccinated already, healthcare workers, some of the people who are on front line. When will the vaccine be available to their families and other members of the community?
First of all, thank you. I think this is important to get this information out to our community. I think one of the things, before I answer that question, I'd just like to share, when Dr. Naqshbandi was talking about development of the vaccines, you know, I've heard in our community that we're very concerned that we're being experimented with. And so that people of color are more hesitant than their white colleagues or counterparts are to get the vaccine. There have been scientists who look like us, most of us on this, and who have participated in developing the vaccines, and one particularly works with Dr. Fauci at NIH. So I want us to know that we are a part of developing these vaccines. That's one. Now, when can we be vaccinated? On February 15th or 16th, the state rolled out anybody 18 years and older who had underlying conditions could be vaccinated. I know that because there was a young woman who was concerned, and I helped her by calling the websites and calling around and got her a vaccine. She had diabetes, type 1. So that I know that if you go to the New York State Department of Health website, you can look and they can tell you. But anyone who has underlying conditions needs to go on that website and find the nearest place to go get a vaccine. And they're continuing to open up sites. You see that on the news and read it, on your phones or in papers. But that's how we get these vaccines. But anyone 18 years and older who has underlying conditions is eligible to get the vaccine.
Thank you so much. Now, will family members have to pay out of pocket for the vaccine?
No, the vaccine is free to everybody. We encourage everybody to go and get the vaccine. They will not be charged.
Thank you so much. Dr. Salafu, if someone had COVID-19 and has antibodies, do they still need to take the vaccine?
Thank you for that wonderful question. But I wanted to piggyback on what Ms. Winston just mentioned, because it's a very important point. That is some statistics from our own hospital show that the commonest causes were hypertension, diabetes, obesity, heart disease, lung disease, kidney disease, and the like. So those are quite common. So if you have any of those comorbidities and you are over the age of 18, I think that you should protect yourself and get the vaccine. To my question, if you had a COVID-19 and you have antibodies, should you get the vaccine? The answer is yes. Okay. There's only one scenario where you might wait for 3 months before you get it, which is if you had antibody treatment. There is a treatment called monoclonal antibody treatment, because that's an antibody. You have to wait for at least 3 months. And there's another one we call plasma. If you were treated with plasma, you need to wait for at least 3 months before you get the vaccination. But if you had the COVID-19 and you have just recovered, your symptoms are gone, there's really no timeline, you should just get it as soon as possible, except those two scenarios.
So thank you. Does a person need a negative COVID-19 test before taking the vaccine?
The answer is no. And that is because if you didn't get COVID, there is no need to test to determine whether you have COVID or not before you get the vaccine. The vaccine is preventative. So what we're trying to do is to prevent the disease in the first place, right? So if you don't have symptoms, you haven't been, admitted to the hospital, or you haven't been tested positive for COVID-19, and even if you did and you recovered, you still have to vaccinate anyway. So the whole idea is prevention. So the answer is no, you don't need to test yourself before you get the vaccine.
Okay, again, thank you. What about if I miss a dose? Can I just get another vaccine, or do I have to take the same vaccine as my first dose?
That is a beautiful question, because that is just by human nature, right? We all try to do the right thing, and then you get your first vaccine, and then you get an appointment to come for your second vaccine, and circumstances may not, permit you to go at the time that you were, given the appointment to go for your second vaccine. So that potentially could happen. But we want to make sure that everybody understands that it's so important to go with what we know right now. What we know right now is based on the evidence of the clinical trials, right? The clinical trial said for the Pfizer, it's 3 weeks. For the Moderna, it's 4 weeks for the second dose. Just remember that. There's actually free websites. You can actually go and then put your name, and then they will keep texting you to remind you about your appointment. That website is called VaxText, VaxText, VaxText. It's free. You go in and then you put your first dose, and then they will automatically keep reminding you about your second dose. So please remember your second dose. However, if you forget, remember the trials we're talking about the minimum time to get your second dose. The trials did not talk about the maximum time to get your second dose. So the 3 weeks and the 4 weeks are basically don't get it before 3 weeks and don't get it before 4 weeks. But what the time interval after that, nobody can tell right now. So I would recommend that if you miss your dose, just go and get it the next available appointment and go and get your dose. This is very similar because of the pandemic and the way everything escalated. The research was done to provide booster doses very quickly so that we can get out of the pandemic. But if you go to the normal vaccine story, which is every other vaccine, and all of you, if those who have children know that, you take your child to the pediatrician, you give a vaccine, after 6 months, you go and you get another booster dose and so on and so forth. There are intervals, really large intervals before you get your booster doses. But this was too serious to not wait for that long. That's why the studies made it so short, so that we can get the booster quickly, get the antibody levels higher, so that we can kill the pandemic as it is right now. So again, the answer to that question is, it's a minimum to getting your second dose, but there is no maximum time to getting your second dose.
Thank you so much. That is very helpful. Dr. Augenbraun, what is herd immunity and how long will it take for us to get there?
Herd immunity is a concept that tells us how many people in the population need to become immune to a particular infection such that that infection can no longer propagate in the community. I guess it insults us a little bit because it refers to the lot of us as a herd, but I wouldn't take too much from that. I wouldn't feel insulted. But it's a basic concept, and it varies by disease. Diseases that spread very effectively, like coronavirus, the herd immunity, the percentage of people in the community that need to be immune to the infection so as to prevent ongoing propagation is rather high. And I think Dr. Salafu referred to some of this. It's on the order of 80%, let's say, or 90%. For other diseases, it's much lower. But for the disease that we're talking about, we have to get up to around 80% or so before we can feel that the immunity actually is going to snuff this out. Now, I do want to say, though, that it's not just about vaccines. Keep in mind that herd immunity, we can contribute to herd immunity by doing the simple things we've been doing for many months: social distancing, wearing masks, avoiding close group contacts. And that's a sort of form of immunity, right? So if you combine immunizations, vaccinations, and all those measures, we can reach adequate levels of herd immunity in a relatively short time. But we've got to keep doing this, and it shouldn't take away from any of the efforts to get the population vaccinated, because we're really looking for what I like to refer to as sort of a belt and suspenders effort here to keep those pants up, everything together. And so the vaccine's really important, really important.
Thank you so much. Are the vaccines effective against the new variants, as far as we know?
Yeah, a lot of people are talking about that, and the press will harp on this issue too. And I want to caution everybody who's listening to be a little bit cautious about what you hear in the press, because as you know, they like to sort of fan the flames of concern and worry. It should be recognized that viruses mutate all the time and create new strains all the time. It's in their nature because they replicate so quickly, and they're prone to making errors when they replicate and create mutations and various strains. The question is, do these new strains pose a bigger risk in any way, shape, or form versus the old strains? And there's some suggestion that some of the strains that have popped up, particularly the South African variant that people have probably heard about, they may be more transmissible for a variety of reasons. And the other concern is whether or not the vaccinations that we're talking about will be equally protective against those strains. And it gets into a sort of a complicated soup about what the vaccines actually do and how the strains are different from the original strains that to which the vaccines were formulated. I think the thing right now is that we don't really know. We're not absolutely certain. But I will say that it looks like the vaccines are quite effective against these new strains. They may not be as effective as against the old strains, but they're still quite effective. And so we should not think that we're going to be abandoning these vaccines now simply because of the appearance of new strains. Get the vaccine.
Thank you so much. And now we still have a few minutes to take questions from our audience. And so the first question is, what do we know about the risk of COVID transmission from individuals who have been vaccinated?
Mike, you want to take this?
The risk of transmission, if I understand the question correctly, it's a good question and it shows some good insight because, again, if I understand it, one of the things about the vaccine is that we know that the vaccines prevent disease in the individual who has received the vaccine. What we're not entirely clear about is whether or not the vaccines prevent colonization with the virus and therefore prevent the individual who's been vaccinated from simply transmitting the virus, whether they get infected and sick or not. We don't really know. Although there is accruing data, and data will be forthcoming that suggests that these vaccines actually do prevent colonization and do prevent us from becoming purveyors of disease, even if we can't get sick. So again, we think that that's going to be super important in terms of getting the vaccine, because not only is it going to prevent you from getting sick, it's going to prevent you from getting this infection, this organism, and transmitting it to your loved ones and other people in your community. I think that's what that question was driving at.
Thank you. Another question, who benefits more from the J&J vaccine?
Dr. Jibande, you want to take this one?
So, as Dr. Augen Brown mentioned earlier, that the efficacy of Johnson & Johnson vaccine sounds like a little bit lower than Moderna or Pfizer. Not significant, but it's a little bit lower. However, there is two ways each of the vaccine work. One, it's preventing the disease, and two, it's preventing the severity of the disease. So I would say even with the Johnson & Johnson, if the efficacy is a little bit lower, but actually the studies showed that the efficacy of preventing severe disease when somebody gets the infection is still very high. So anyone who is eligible for Pfizer and Moderna vaccine will be eligible as well for Johnson & Johnson. I hope that answered your question.
Okay.
I just might also jump in there and say the other. I don't know if this appeals to certain people, but the Johnson & Johnson vaccine is one shot. So if two shots give you the willies, one shot is available. And the other thing that's advantageous about the Johnson & Johnson vaccine is that storage issues are not as pressing as they are for the Pfizer and Moderna, where we have to keep these things in a deep freeze or they become inactive. The Johnson & Johnson is much more amenable to routine environments. And so we'll be able to move that around much more swiftly and much more easily. So I think it'll be a useful vaccine for us.
I want to add something to that. There was an article in the New York Times yesterday discussing this same issue. And the discussant actually said that we are not even sure that the CDC will keep it as one dose for a long time. And the reason is because if they find out that actually giving two doses, just like the other ones can give a booster, because this one didn't give a booster. The reason why the others got to 95 is because they got a booster. So it is possible that as we move along, they might actually do additional studies to give the booster the way the others gave it, and the results might actually go up to the same rates. So the discussant said we should not count that out. So I just want to let people know that.
Okay, I'm going to take one more question because we're kind of running close to our calendar. How can people in our communities get their vaccines, especially elderly and people who have trouble getting to locations in the community?
I'll take a stab at that. I think that there are a couple things. People who are elderly who can't go out, they have physicians probably or being seen somewhere. They can call their doctor's office, or they have these various uh, uh, ambulances or DAST or whatever that pick people up. People get around now. If they're really concerned, I would suggest that they call their doctor's office and see if there's some way that they can get transportation, if it can't be family or friends or whatever. And I heard them say, especially the elderly, just ask the questions for them. Look on the website and ask questions. If you keep asking, there are people out there who want to give vaccines and who want to vaccinate you. And you can always, I'm saying this, if there's somebody, whoever asked that question, if they have an issue, I welcome you calling us at Downstate, and we will help you figure out a way to get that elderly family member a vaccine. We might not give it, but we will do our best to help get you to get a vaccine.
Thank you. And there's one last question. Someone is asking if Dr. Eugene's office offers any assistance to the community regarding information or transportation for the elderly, etc.
I didn't hear the beginning of that question.
Thank you. You want me to answer?
Yes, and they're asking whether or not you are offering any assistance to get to the mega vaccine site at Medgar Evers.
Thank you very much. My office is offering many assistance during the COVID situation. But to tell you the truth, we didn't have assistance for transportation, to the site. But this is something I believe that we're going to work on, especially for those people who cannot get there, who would need this type of service. Thank you for this question. And this is what we do as elected officials. Based on the request of the people, the need of the people, we do everything that we can do to fulfill that need. And I guarantee you, I pledge to work on that. Thank you so much. But there are many other services that the community can benefit from our office. Thank you.
Thank you.
I just want to say something, Dr. Spraker. One of the things that may be helpful for some of the elderly, because the good old block association, and many of the block associations within these zip codes are making arrangements to help to transport people. So if people live in certain areas, they can reach out to their block association president and try to get that help, because that is still available to people. It still works very well in this community.
Okay. And additionally, there are some churches that are helping, assisting the elderly to get to where they need to go. There are community resources that I guess we would consider traditional, that are beginning to step up to assist with getting the vaccine now that it's more available. So I think we're running out of time. I want to thank everyone who attended today's event. This is critically important. Dr. Matthew Eugene, we really appreciate your reaching out to us to answer these types of questions. We look forward to serving your community and to doing more of this. So it's our hope that this will not be the last time that we have such a forum. I'm going to turn it over to Dr. Booten Foster.
Thank you so much, everyone, for joining us. Councilman Dr. Matthew Eugene, thank you so much for creating this space for us to speak. As Dr. Claire said, vaccine confidence. I like that. Vaccine confidence. And this is what we want to do. It is a very personal decision. While many of us, if not all of us on the call, have made the personal decision to get the vaccine, we can only give you the information that will educate you and empower you to make the best decision for you and your family. So in the meanwhile, we encourage you to watch your distance, right? Watch your distance. The other W is wear your mask. And the last one is wash your hands, right? So please, we encourage you to continue to practice these safe measures and reach out to your physician. As many of the providers said, speak to your doctors about your own personal journey and your own personal health conditions as you make the decision for the vaccine. We thank you again for joining us. This will not be the last event. We know there are many more questions that we could have answered, but we want to make sure that the doctors can get back to work. And we will take steps to make sure that some of the questions are answered. And we will have another opportunity to share answers with you as new developments arise. So thank you again. Be safe and take care and have a good night.